sorry, this is not so conventional by doing the Q&A first and doing the lecture, okay? Understanding chest pain saves life, and after this lecture, I reassure you that one day you will save someone's life by going through this talk. Okay, so again, the chest pain, there are many reasons for chest pain, and it's easier to understand if we understand what organs are under the chest. So first of all, we have the ribs and bones. Okay, we have the big vessel coming out of the heart. Okay, this is called aorta. And we have the heart, we have the lungs, and we have the swallowing pipe. Okay, so any problem with these organs can cause chest pain. And you can see the next slide, there are many reasons for chest pain. Okay, but don't bother remembering this. Most important, remember the 5 life-threatening chest pain, okay, that you should address it and don't delay seeking help, okay? So as I mentioned earlier on, we have the lungs. So someone with a clot that goes to the lung can cause chest pain, and this will damage the lung. Someone with a collapsed lung can cause chest pain. Someone with a tear of the big artery can cause chest pain. Someone with a tear of the swallowing pipe, chest pain, and finally, someone with a heart attack can cause chest pain. And all these chest pain are so-called life-threatening if you don't address it immediately. So, and again, like most of the question, I think most of you are concerned. That's why I put this slide up, and this is the most important slide to know the character of the chest pain, because different organs, different problems with the organs have certain characteristics of the chest pain. For example, for a heart attack, as I mentioned earlier on, dull pain, cold sweats, may last for 30 minutes, not going away. It may go to the arm or jaw. And usually these patients, they have risk factors. They may be smoking, they may have high cholesterol, they may have hypertension, diabetes, so on and so forth. So this is the character of the chest pain for heart attack. For lung pain, usually they are more sharp in nature. So you feel like a needle poking kind of pain. And specifically for collapsed lung, the pain usually is worse when you take a deep breath. You get more painful. And usually it happens to young teen men. They are smokers, or they have a trauma like a traffic accident. So these are things that we look out for. And for those people who have clot in the lung, so these are, again, lungs, sharp chest pain, and they may have risk factors like they have immobility. They didn't walk much, because by not walking much, or you have a long-haul flight where you sit on the plane for a long time, this may form clot in the legs. And the clot most commonly, and the clot in the lungs most commonly come from the legs. So these are the things that we ask. And then we have the tear of the swallowing pipe. So these people would have, usually have vomiting, and they would develop pain after that, and usually it's associated with vomiting of blood. And finally, a tear of the big artery of the heart. So you have a tearing pain, which can go to the back of the body. So different pain have different characteristics, and this probably is an important slide that will address most of the question. Okay? So with all these 5 life-threatening causes, the end point is, if you don't treat it immediately, it will lead to sudden cardiac death. Okay? So you need to seek help immediately. Okay? And remember the pain that you have. Okay? So what is sudden cardiac death? So in the news, you will always hear stories about young to old people collapsing. Even when healthy people running, they can still collapse and pass away. So even like a surgeon himself, okay? So before we understand what sudden cardiac arrest is, probably it's important to know what normal is. Okay, so this is a normal heartbeat. Okay, you can see the heart beating once each time, and each pump will deliver blood throughout the body. And when we put these wires on the chest wall, we can detect what we call as an ECG, which is represent the electrical activity of the heart, and this is a normal ECG. So every spike is one heartbeat. So this is what we want. So what happened during a cardiac arrest? So just pay attention to the first few beats, which is a normal heartbeat, and this is a normal heartbeat, and this is the ECG of the normal heartbeat. It's followed by a abnormal electrical firing of the lower heart, and you can see the heart is not pumping anymore. It's just fibrillating. So the body is not getting enough blood supply at this point in time, and that's the point where people collapse. And when you put on an ECG, this is how it looks like. It's just a scribble, it's just a quivering. And if you compare to a normal heart, this is how it looks like. The heart is pumping nicely, and this is not pumping at all. So the blood is still pooling inside the heart. And if you don't address it quickly, you lead to cardiac death. Okay, so you need to address this type of problem quickly. So when this happens, when a cardiac arrest happens, this is the most important step that everyone should learn. So this is called basic cardiac life support, and this can be learned by anyone. So there are courses available by the SG First Aid or the Singapore Heart Foundation, where you can learn how to save people's life. So there are steps. Okay, the first step is to attend to the patient, call for help. Second step is to do CPR immediately, and anybody able can do it. Okay, and finally, when you call for help, you should call for AED. It's a defibrillator where it helps to reset the heart to a normal heartbeat. And when help comes, they'll bring to the hospital and they get advanced care. So this is very important. And this is what happens when you get an AED and defibrillate, the third step, where this is the irregular heartbeat that you see just now. And when you put an electrical shock, you go back to a normal heartbeat. And lay person can do it with an AED machine, where you have it everywhere. Okay? So I want to show you this, what happened if you apply only certain steps of the chain of survival like I mentioned just now, and in terms of the survival after the arrest. So if someone collapsed here and you don't do anything, after 12 minutes, 0 chance of surviving. If collapse and you don't do anything until the 10th minute and you get an AED to shock the patient, survival chance is just 2%. And if you apply CPR, chest compression, and just shock later on, survival is 8%. If you call for help, CPR early, shock early, survival 20%. And if you do all these 3 again, and you send to hospital, survival 40%. So this truly can save life, okay? And I'm going to just give 5 minutes to show you this video. This is a very nice video that shows the whole process of the chain of survival, okay? So the first 3 steps, okay? So you can see this gentleman here, he collapsed, okay? And these are the lay person, okay? They went to help him. And the top part here is the time from him collapsing. So they're asking the patient, how are you? Assessing the patient and feeling the pulse, and they're calling for help. So when they call for help means that they want to get the defibrillator as soon as possible. And here you can see this guy here holding a defibrillator. This is a defibrillator. It's a simple device, simple to use. And you can learn this if you attend those courses for basic cardiac life support. Okay, they're assessing again, and they feel no pulse. You can see this man here is going to start to do CPR, which is a chest compression. And this guy is opening up the defibrillator and putting onto the patient's chest wall.
Adult mode.
So the AED will give you commands to follow. So it's a very easy to use device that tells you what to do.
Pads.
So when the pads are put on,
pads.
so this is what actually is happening inside the patient's body, inside the patient's heart. And when the AED is put on, just pay attention to this dark line here.
Apply pads to
So the pad is on, and you can see the heart is fibrillating. Okay?
Analyzing heart rhythm.
The device will analyze, and when they think that you need to shock,
press flashing button.
they will charge, and they will ask you to shock. You can see this sharp spike is the shock.
delivered.
Okay, it's still
Provide
fibrillating,
impressions to
and you
the
see this sharp spike here,
The heel
it's
of
still
one
not
hand
fully
should be
restarted
center of
yet,
chest.
so they have to
The other
continue
hand
to do
should be on top
CPR.
of first hand.
So most of the time it's
Push
still
down
fibrillating.
hard at least 5 centimeters.
And during the course, you will learn the steps of doing proper CPR, how to do it properly, and how long you need to do it.
Lean over the patient.
You can see this sharp spike
Elbows
here
straight.
is coming back.
Use
But
body
it's not
weight
enough.
to push. Push down hard at least
So you can
5
see here,
centimeters.
it's coming back. The heart is coming back. Okay, and the patient survived. All right, so among the 5 reasons, okay, heart attack is the most common reason for sudden cardiac death. So this is what I'm going to focus on from now, okay? So what is heart attack? So heart attack is a problem with a blocked artery, okay? So it's when the heart is completely blocked up and there's no blood flow, okay? The red color dots here are blood flow. This is a normal artery. This is a narrowing of the artery. There's still some blood flowing, but the heart attack is when there's totally no blood flow. Okay, so, and heart attack is a unstable situation and should get help immediately as soon as possible. And almost always heart attack does not happen overnight. It's usually patient have an underlying narrowing of the heart to start off with, okay, which they don't notice, okay. And why you are asked why is there a clot in the artery, is when there's a narrowing and when the lining of the narrowing tears, which can happen, and this form clots immediately and completely block the artery. So heart attack is, the numbers are getting more and more every year, okay? And more important, this slide is, it shows us that heart attack can happen as early as 40 years old. Although the numbers are not many, but it can happen. And as we grow older, the numbers will get higher, okay? And I'll explain to you why the numbers get higher later on as we grow older. So this is a process of narrowing of the heart. So heart attack is the end point of this process called arteriosclerosis. And this process is a build-up of cholesterol with time. So it can happen as early as 30 years old, where the cholesterol starts to build up. They may not feel anything. And with time, if we don't take care of yourself, the blockage may be so severe that it can cause a heart attack at the age of 40. So again, we emphasize the chest pain character, dull pain, radiate to the jaw, shortness of breath, cold sweat, vomiting, and maybe fainting. So this is an important sign to watch out. So, and more important is when you have these symptoms, and this is probably the take-home message, is to seek treatment early, okay? And you can imagine, just want to show you what's happening during a heart attack to the muscle. Imagine this big circle is the muscle of the heart, and the small circle is your arteries, which is completely blocked. Within 20 minutes, the black shade is the damage done to your muscle as it starts to happen. And within 12 hours, the whole muscle will be damaged, and usually it's not reversible. So the earlier you seek help, the earlier we unblock the artery, the more muscle is safe. So we have a saying that time in muscle. So the faster you go seek for help, the more less damage to your heart. So thankfully we are in Singapore, and the system that we have, our hospital, we have a system in place that will help to unblock the artery as fast as 60 to 90 minutes. We can unblock the artery immediately. But the limiting factor here is the patient themselves. So if the patient delay the treatment, despite knowing them they have chest pain, that will lead to damage that we cannot help anymore. So I have a patient that they waited for 10 hours before they come to the hospital. That's a bit too late, okay? So in the hospital, what we do is that we put on the ECG again, we diagnose the problem, we send some blood tests, confirm the problem, and we send patients to what we call a cath lab. It's a minor OT, where we do a procedure called angioplasty. And usually we go through the wrist, the artery of the wrist, where we make a small needle puncture, and put a small little tube under local anesthesia. So patient is still awake, and they can still talk to us, and we'll do this procedure called angioplasty. And after the procedure, it's as simple as putting a pressure bandage just to stop the bleeding. And the pressure bandage is just there for 2 hours, and remove the bandage. So this is the angioplasty, the angiogram part, where we put the tube in to the wrist, and the long tube all the way to the heart artery, like this one. So there's a tube that goes to the heart artery, and we look at the problem. So this is what it looks like during the angiogram. So when a patient will have heart attack, so black means blood flow. No black means no blood flow. So this is an important artery. You're supposed to see one artery flowing down here, and it's completely blocked. And we unblock it. This is how the artery looks like. And it can be done as fast as within half an hour to 1 hour. So this is, and usually we unblock it, we work with a stent. This is how a stent looks like, and it's the size of the stent at the palm of your finger. So sometimes when we do the angiogram, we can find many, many blockages. Okay, so we have blockage of all the arteries, one here, and one here. So a lot of time with this kind of blockages, and if it's not completely blocked, we can sometimes about 5 to 10% of the time call the surgeon, where they are more appropriate to do a different kind of procedure, where it's called a coronary artery bypass, where we use the patient's own artery to bypass the blockage, meaning we put one artery here and go to the end of the artery so that we bypass this blockage. So the end of the artery is still getting blood supply, regardless of what is happening at the beginning. So, I mean, of course, this is a major surgery that don't happen most of the time. Okay, most of the time we can do it with angiogram and angioplasty. Okay, so this is the emergency part. Okay, so we have to deal with that. Seek help quickly. Okay, don't wait. Okay, don't be shy. So, but most of the time, most of the people would have a narrowing of the heart artery to start off with. And we can actually detect this before a heart attack happens. So this is there are many ways, depending on the degree of the blockage. We can use many methods to detect the problem, okay? And again, symptoms is also one way to detect the problem. If you have almost very severe blockage, you may have chest pain, again, shortness of breath, especially when you exert yourself. Let's say you climb the stairs or you exercise, you may get chest pain, shortness of breath. This is a sign. So seek help immediately. I mean soon, not to say immediately, okay? Yeah. And so symptoms is one way, okay? Another way we can help you to detect, even if you don't have symptoms or you have mild symptoms or you're not sure, then we can stress the heart. We can do a stress test, okay? Run on a treadmill, put on an ECG, and that will help us to detect whether there's any blocked artery. And there are also more advanced methods like doing a CT coronary angiogram, a CT scan. This is a non-invasive X-ray scan where they can give a 3D version of what's happening of the artery, even before the heart attack happened. So there are many ways that we can use to detect the heart, okay? And we can use ultrasound scan to see whether there's any damage to the heart. This is a normal heart pumping, and you can see the difference. This heart is not pumping much. So this is a weak heart caused by a heart attack, okay? And this is what we want to avoid. Okay, if you don't treat the heart attack early, this will happen. The heart will get weak and it will be permanent. So treat heart attack early. So, and if we manage to detect the narrowing, okay, with all the tests, the stress test, the CT scan, so again, we can do the angiogram again, okay. Here's the narrowing. Here, you can put in a stent. So this is a stent, and this is how it looks like after putting a stent, okay. Okay, so we don't put stent or do bypass for everyone. We only do it when you have symptoms or when during the emergency, like a heart attack. Okay, so this is just the tip of the iceberg. So what we have talked about is just the tip of the iceberg. So a lot of time, as I mentioned, at 40 years old, you can get heart attack. At 80 years old, you can have higher risk of heart attack. But if you have risk factors, you'll get a heart attack at an earlier age, okay? So it's equally important or very important, before things get out of hand, the tip of the iceberg, you can actually do things to help to even prevent the blockage from happening. Okay? So risk factors, there's the 7 habits, okay, that we should adopt. So get active, don't be sedentary, control your cholesterol, eat healthy, don't smoke, control blood pressure, lose weight, and reduce your blood sugar. So cholesterol, usually we do some tests, see how high your cholesterol is, and usually you can start with lifestyle change, diet, exercise, and if we can't control your lifestyle, we can start medication called statin, okay? And high blood pressure, we try to aim the blood pressure to less than 130/80. High blood pressure is a condition where the pressure inside your vessel is very high, and imagine every time your heart beat, it's like a hammer hammering your arteries. So that is damaging to the heart, to the arteries. And not only to the heart, it also can affect the kidneys, can cause kidney failure, can cause stroke. So it can happen throughout the body wherever the artery is supplying. Okay? And the general management of a healthy lifestyle, exercise at least 30 minutes a day or 150 minutes a week, at least a moderate intensity exercise, which is equivalent to a brisk walk, at least. But you can do more by all means. But before you do more, make sure you check your heart first. Okay? And stop smoking. This is the most sinister thing that one can have, smoking. So it's very damaging to the artery. And diet, I would always advise Mediterranean diet, more vegetable, more fruits, 50% of the time. If you want to take meat, take fish, chicken, okay, without the skin, and only a quarter of carbohydrate. So in our Asian country, we take like a whole plate of noodles, bak chor mee, okay, and rice, okay? So try to cut down on that amount, okay? And again, exercise, I mentioned earlier on, these are the kind of exercise you can do. Aerobic exercise is the better one, okay? But also strength training is also good to protect your joints, prevent you from falling, that's important as well. So again, try to aim for this, okay? Healthy food, and avoid this. And after stenting, okay, this is a side story. After putting a stent in or after fixing the artery, it's very important for you to take your blood thinner, okay? All right, thank you.